Aloha Kauai. Here's our daily COVID-19 briefing from Team Kauai for Wednesday, March 25th. There are 5 confirmed cases of COVID-19 here on Kauai. We now have 4 adult visitors in isolation and 1 adult resident who remains in isolation at home. Statewide, we now have 95 total positive cases with 6 new cases reported since yesterday. Yesterday, we announced Mayor's Emergency Rule Number 5, which set local guidelines to the governor's statewide stay-at-home order. The stay-at-home rule essentially keeps people home with very limited exceptions. Again, to view that emergency rule, please go to www.kauai.gov/COVID-19. Since announcing this rule, we have understandably received an overwhelming number of questions and concerns. So I'm hoping today's message clears up some confusion. Here's the bottom line: everyone should be staying at home. We know this virus is spreading in our community, and we know the more we interact with one another, the faster it spreads. My commitment as mayor is to protect the people of Kauai. We cannot protect ourselves from this virus if we continue to allow it to spread. So a stay-at-home order is necessary to, 1, get a decent assessment of how far and wide it has spread into our community at this point in time. 2, to stop it from spreading now so that we can, 3, get us back to work so we can begin economic recovery. Think of it this way: the less we move right now, the quicker we can get back to normal. This imposes a financial and emotional difficulty to most, if not all of you. And the truth is, it will get worse before it gets better. I understand this, and I'm sorry it has to come to that. But at this point, we need to take bold action now to help protect life and safety. This disease has a mortality rate of 1 to 3%. And on an island of roughly 70,000 people, that means we risk losing 700 to 2,100 people in our community unnecessarily. I cannot and will not take that risk. This disease is preventable if we stop moving. Yesterday, we talked about how this rule is going to take self-restraint and self-discipline. Yes, the rules get into very specific guidelines and exceptions, but let's break it down this way. Stay home. As much as you can, stay home. But if you feel you need to leave your home, first ask yourself this: am I leaving my home to provide an essential service to the health or well-being of our community, such as to provide for public safety, public infrastructure needs, health care, child care, or education, sanitation, food or supplies necessary for household consumption? Does my job help to ensure that any of these critical services can continue to function? For example, if you're a plumber, if you must do a job to repair plumbing at a hospital or a restaurant, yes, that is essential. If you're a graphic designer helping a local restaurant to publicize new takeout options, yes, you are supporting an essential function that should be done at home. And if you must leave your home for an essential need, ask yourself if it is necessary to bring others from your household and expose them. And if you are going out in public, understand that every surface you touch is spreading germs you can't see. So please wash and sanitize your hands often. Lastly, if you need medical attention, of course, this is an essential need. Again, exercise self-discipline to help stop the spread of this virus. That said, we're going to be reviewing the feedback we have received thus far to determine where the rules may need to be refined. Finally, I want to share with you a brief message that I received from Jen Shahanovich, President and CEO of Wilcox Medical Center and Kauai Medical Center. Jen reports that Wilcox is seeking close to a 40% reduction in visits to the emergency room, including trauma cases, thanks to less people being on the road. The emergency department is available for emergent care, but please stay at home if you do not have an emergency. By utilizing phone, email, and other electric healthcare encounters, they are able to preserve their resources at Wilcox Medical Center for critical care. Jen urges everyone to please follow the advice of healthcare agencies like the Hawaii Department of Health and Centers for Disease Control and Prevention and comply with the stay-at-home order. These measures will help flatten the curve and get us through these difficult times. Mahalo, Jen, for your report, and mahalo to everyone working in our healthcare industry for your selfless service to others, and a big mahalo to all of you who are heeding the guidelines. A 40% reduction in ER visits is a big win. It helps us to know that the sacrifices we're all making is helping to ensure that we can care for those in need. We're doing well here on Kauai, and I expect us to set an example for the rest of the state and the nation of how to beat this disease, which is trying to break us apart. Lastly, I want to say that I know we are in very trying and stressful times, but please be kind to one another. Yelling or threatening people is not helping us to get through this. Now more than ever, we have to work in unity and live aloha. That is what will pull us through this. Again, refrain from social gatherings of groups of 10 or more. If you must interact with people in your daily life, keep a distance of 6 feet of separation. Stay home if you're sick. Keep your children home if they are sick. And wash your hands regularly. Stay connected with us and each other on the official county Facebook page or on KEMA page at www.kauai.gov/COVID-19. Also, you can help by sharing information with members of your family who may not have access to the internet or do not follow the news. The Center for Disease Control is also updating its website regularly with detailed guidance related to COVID-19. For more information, please visit coronavirus.gov. We can do this, Kauai. Take care of one another, and aloha.